the difference between a regular cleaning and a deep cleaning? Well, for a regular cleaning, that means there's no bone loss. That means your bone is healthy. Maybe there's a little bit of inflammation in your gums, or maybe your gums are healthy and we can clean the superficial portion surrounding the teeth and gums. Now, when we measure how deep the gum pocket is, so the gum surrounds the tooth like a turtleneck, and we measure how deep is that collar. So if it's 1, 2, or 3, we measure in millimeters because teeth are tiny, that means it's healthy. If it's 4, 5, 6, or more, that means that there's been some bone loss, some inflammation, especially if there's bleeding. This is another reason why dentists take x-rays. With these x-rays, you can tell if there's been bone loss. If there has been, then you absolutely will need a deep cleaning. The other difference between a regular cleaning and a deep cleaning is the way your teeth are cleaned. So we will divide the area in quadrants. Typically, each quadrant, so upper right, upper left, lower right, lower left, each quadrant will take about an hour of time to clean the area. The area is numbed so that there's comfort while the professional's going into that gum pocket and cleaning out the tartar debris and that biofilm that's lurking in there.